Davinlin, board certified dermatologist. Today we'll be talking about hyperpigmentation and sun damage, what the main causes are and how to actually solve it. First of all, pigmentation is super common. It's due to one of three things: genetics, sun exposure, as well as hormones. So the most common pigmentation you guys would know is something called melasma. Melasma is due to a genetically prone individual. In other words, you may have a gene defect which predisposes you to pigment, but there are other exogenous, in other words, external factors that also come into play. And they include UV radiation as well as hormones. So we know that UV radiation, especially the visible light wavelengths, but also the UVB and UVA, stimulates your melanocytes, or the pigment producing cells, to produce more pigment. Another contributing factor is, of course, hormones, and that's why melasma is also called the mask of pregnancy. This usually occurs within the first 1 or 2 pregnancies. However, in most cases, it can settle down. So about 50 to 60% of cases settle down without intervention. However, another 40 to 50% persist. Now, the treatment for this is a little bit tricky because most cases require some sort of intervention by a dermatologist. And they include things like sunscreen, obviously, but also anti-pigment creams called tyrosinase inhibitors. Additionally, certain tablets can be used and they modulate the amount of blood vessels which feed the pigment cells. And of course, things like lasers and chemical peels. This can get very costly, and hence later on I'll provide an at-home solution that can be effective for some individuals. Now, the second most common cause of inflammation is called post-inflammatory hyperpigmentation, or PIH. This is secondary to inflammation, and the most common cause of inflammation is actually acne. So by suppressing acne to begin with, in other words, treating the root of the cause, that can help resolve the remaining and also prevent future PIH. So treatment for this is very similar to melasma. However, unlike melasma where it's recurrent, post-inflammatory hyperpigmentation usually resolves. So they include things like your tyrosinase inhibitors, in other words, prescription creams, your tablets, your chemical peels, and also lasers such as pico laser. Again, there are effective as well as cost-effective home solutions which I'll discuss shortly. The third main cause of pigmentation is basically genetics. So in genetically susceptible individuals, you can have what's known as freckles. So freckles are super common. They occur usually in lighter skin types, and they fluctuate with the seasons. So most often freckles darken during the summer months and seem to lighten but not disappear during the winter months. Again, treatments are aimed at decreasing the amount of superficial pigment, and hence things like creams, especially your glycolic acid creams, your salicylic acid peels, as well as certain lasers and novel peels can help reduce the amount of freckling. Now, the other form of pigmentation which is super common is due to age, and these are called lentigos, and the most common causes are solar lentigo, in other words, sun-related pigmentation. And they usually are solitary, in other words, 1 or 2 lesions, and they usually occur in the 30s and 40s. These are a little bit more persistent, and unfortunately, home devices are not as effective. So, the biggest hint I can give you guys to sort out pigment is to find out what kind of pigmentation you have, because some of these can be sorted out using home devices and home products, and some of these, for example, like your solar lentigos, in other words, age spots or actual sunspots, cannot be treated using home devices. So identification of your pigment type is super important before considering accurate treatments. Today I want to introduce you guys to the Current Body LED Series 2 mask because it is at the forefront of this technology, using clinically proven wavelengths to not only combat pigmentation but also improve fine lines, skin texture, and overall radiance. What sets this mask apart from others is its new Veritace technology. All you have to do is tap the card that comes in the box like this, and all the testing data from your individual mask is there. As you can see, each bulb is tested to ensure it emits the highly specific frequencies that are proven to deliver skin improvements. This level of precision is something I've never seen before in a home device. I don't think any other brand is doing it. So how does this actually work? The current body LED uses a combination of red and near-infrared light to penetrate deeply into the skin, calming inflammation and preventing melanocytes from overproducing pigment. Inflammation is the key driver of hyperpigmentation, and by reducing it, LED therapy helps break the cycle that keeps dark spots lingering. The new deep near-infrared wavelengths take things even further by improving skin healing, reducing fine lines, and enhancing circulation and a more even complexion. Clinical studies show that with consistent use, users see firmer, smoother skin with noticeable reduction in pigmentation in as little as 4 weeks. Beyond its technology, the Series 2 mask also features a revamped design for better coverage and fit. Its flexible liquid silicone design has been tested on thousands of faces to ensure maximum comfort and effectiveness. A key to this upgrade is the chin strap, which is important because it improves coverage around the jawline area, which is often neglected in treatments. This brand has been kind enough to give you guys 10% off all current body devices using the code Dr. Davin. I will put that in the description down below. So guys, to get the best results, LED therapy should be part of a comprehensive skincare routine. First and foremost, I can't re-emphasize the importance of daily SPF. This is non-negotiable. Without sun protection, pigmentation will keep returning. For those looking for even faster results and more dramatic results, LED therapy can be combined with professional treatments to enhance their effects. Guys, so there you have it. This is how to solve pigmentation in a nutshell. Remember, not all forms of pigmentation require intervention by dermatologists. With careful planning, consideration, and execution using the right skincare, sun protection, and devices, most cases can be diminished at home.